Hello, my name is Dr. Cindy Morse, and I'm the Lab Simulation Manager here at the Essex location of Community College of Baltimore County. Today we will discuss how technology stimulates outcomes of students using nursing simulation. Welcome to our simulation lab, which is made up of 6 patient care rooms that simulate a hospital environment and 3 interprofessional education rooms. The simulation suite is equipped with high-fidelity mannequins that are controlled by the faculty from the control room. The mannequin settings can be changed before and during the simulation based on the students' reactions as the simulation progresses. Each simulation room contains a bedside patient monitor and a workstation on wheels, providing the students with further access to patient information via the electronic medical record. While this simulation is happening, it can be live streamed into one of the educational rooms to a peer audience who are observing in the debriefing room. If there is a larger group of observers, the live simulation can also be live streamed into a full-size classroom. Let's take a quick walk through an actual simulation so you can see firsthand what's involved start to finish. The students participating in the simulation are brought into the debriefing room, where the nursing instructor introduces the simulation, assigns the roles, and explains the expectations of the students assigned to each role. The students are expected to role-play different roles such as a primary registered nurse, a secondary registered nurse, night shift nurse, or an in-room observer during the simulation. The students are encouraged to suspend reality during the simulation. Suspending reality during the simulation assists with making the mannequin, which is made of plastic and rubber, more like a real patient. For this simulation, primary nurse, secondary nurse, and in-room observer roles will be assigned to the student participants. After the roles are assigned, the primary and secondary nurse will go into the patient room and the simulation will begin. The students assigned classroom observer roles will remain in the debriefing room, where the simulation will be streamed for the students to observe and document their thoughts. The live stream from the patient care room is accessed using a commercial service provided by Laerdal called Beeline via the classroom computer and projected onto a large screen in the debriefing classroom. Once the stream is running, the instructors will go into the control room to operate the mannequin and the simulation progression. The instructors are able to communicate into the patient care room with audio and visual equipment maintained by Beeline. The instructor can view the simulation through the mirrored glass or through the computer monitor that has access to the Beeline system. When the simulation begins, one instructor is the voice of the patient, while the other instructor is observing the simulation. Students simulate key nursing processes as they would in real life. This includes, but is not limited to, giving and receiving a report, performing patient assessments, and executing clinical decisions based off the patient in the simulation room and the information that is available about that patient. The students are encouraged to check the electronic record for orders just as they would in the real clinical setting. After checking the medication administration record, located in DocuCare, the students are asked to execute those orders by retrieving the medications that align with the care that is needed. The student nurse retrieves the medications from the Pyxis system, which is exactly what they use in the clinical setting. After retrieving medications, the student returns to the simulation room and administers the ordered medication. The DocuCare system is again utilized to provide a barcode scanner to further simulate the documentation of the medication administration. Throughout the simulation, the students in the patient area are pushed to apply classroom concepts in a hands-on, real-life scenario. Patients and their environments are always changing. Having the technology that can be changed in real time with the real-time feedback pushes students to the next level with their ability to prepare for what they will experience in the real clinical setting. Once the simulation is complete, all the students return to the debriefing room and the learning continues through utilization of debriefing. During the debriefing process, instructors ask probing questions to assist students to unpack their thoughts on what's happened during the simulation, what went well, along with identification of areas of improvement. As you can see, we utilize many different types of technology to simulate the clinical setting with hopes of preparing our future nurses to care for patients in the real-life clinical situations. I hope you enjoyed this video that demonstrates how Community College of Baltimore County utilizes technology to stimulate outcomes of students using nursing simulation. Thank you to all who helped make this project a success.